come in, they're wearing their flip-flops, they're walking around, and all of a sudden they'll sprain their ankle or twist their ankle because this has no support and it's not holding in the foot whatsoever. So basically, you want to be careful with these things. Another thing that happens too is when you're wearing these, look what's going on underneath. Your foot's on top, anything can get underneath. I've had people step on wood, glass. I recently had to take someone to surgery because they were dancing in these and they got a big piece of wood in a wood floored venue that they were at, and it got stuck in their foot and they regretted the day they wore these. So it is associated too with just basically problems in the back, problems in the spine, problems in the hips. You just aren't getting that arch support. So not the best type of shoe out there.
And what I've noticed is, having worked in offices before, people are wearing them all day, every day. So there's a compounding of these problems too. And the more they wear them, the higher the risk there are for some of these problems that you mentioned, right?
Exactly, because again, if you're wearing these all day with no arch support, you're basically collapsing your foot, having no heel support. You can get heel pain rather quickly, and you're putting yourself at risk for being exposed to foreign bodies or other elements that you really don't want to be exposed to.
Great. We have another caller. Why don't we take this call? And then we've also got a note, too, that we can talk about as well.
Sure.
Yeah, go ahead, caller.
Yes, my name is Lou, and I'm concerned about the swelling of the foot. Nobody drinks or smokes or anything on the feet constantly, but there's a swelling. It gets real swollen. You can't see the ankle sometimes, and I worry if that's tied into heart disease any kind of way. It really bothers me.
Now, is it both feet or just one foot?
It's basically one foot.
Okay.
It's one foot,
and
it's the foot that my daughter had done on her. She had what's called pancake feet, flat feet.
Sure.
And she had one done.
Okay.
And it was done very well, but it swells up. And when you push your hand on the swole part, you can see the print. And it bothers me. And I'm wondering what can she do, because she's on her feet quite a bit. We bought her a chair so that she can sit down when she does her cooking and stuff. But it bothers me.
And how old is your daughter?
30.
She's 30. And how long ago was her feet looked at or fixed?
Oh, she hasn't had it looked at for, it's been a couple of months now. They said they were going to give her some kind of, I think, a vascular test or something, neurology test. Okay.
Well, a lot of times, especially if she's had any surgery or any work done, you do swell on and off for even up to a year and a half, and that's very, very normal.
This has been like 10 years.
Okay, so if it's been 10 years, I would definitely have someone take a look at the foot. A lot of times it can be systemic related, meaning maybe she has high blood pressure, she can get her heart checked, and what they're saying about those vascular studies is just to make sure she's getting enough blood flow down there. And that if she is pooling just water, that the water is basically going up to where it belongs and circulating around the body. So I would recommend that she get a complete physical if she can at some point.
Now you said, what did you say about the water?
A lot of times it's either you're swelling because you're holding water in the ankle. So we need to get that out of there. And there's a reason usually why that's happening. So I would definitely follow up with a podiatrist, make sure that all the procedures and everything that was done is setting well and set well, and then definitely get a full physical for her because she's very young.
Great.
Okay, thank you so much.
Thank you, caller. Oh, sorry. For those of you out there who are looking for a referral, you can go to the IPMA website at ipma.net or call the 800 number right on your screen. And we'll flash that up again later on. I think we have another caller.
Hello?
Hello, go ahead.
My question is, I'd like to know, I have an older sister, she has rheumatoid arthritis. They recommended her to wear orthopedic shoes, however summer's approaching. What would be your best suggestion?
With rheumatoid arthritis, it's very painful type of disease, and You definitely want that foot support the whole time. I wish I could tell you to wear more of an open toe or something like that, but the orthopedic shoes in the long term are the best treatment for her. You could look for some lightweight orthopedic shoes, but you need the laces, you need something closed toe. It's better to be safe than sorry in these situations. So I would unfortunately, I don't think you should move on to a flip-flop, which is we don't recommend anyway, or any type of sandal.
Thank you for your call. We did miss a call, but we got a note.
Sure.
One caller wants to know if there's a correlation between athletes' feet and foot odor.
Yes, there is a strong connection. Athlete's foot is also a fungus. It also happens a lot in the summer. So people start noticing that, feet are giving a little bit of odor. Usually it's correlated with an athlete's foot. We tend to wear shoes a lot repetitively in the summer, over and over again. So it kind of breeds that fungus and that moisture. So you'll notice that your shoe is smelling, you'll notice that your foot is smelling, and most likely you have some type of fungus on your foot. So it is very much correlated to the athlete's foot.
And there's a lot of over-the-counter treatments that are advertised on television a lot, and without naming brand names, for instance, typically, how effective are these treatments at treating athletes' feet?
Unless you catch it right away, and it's very hard to know if you have it right away, they're effective. You notice you have it, you've had it before, it comes the next day, you go ahead and get the over-the-counter. If it's been lingering, it's been going on for a couple of weeks, go see a professional. It's worth the prescription to get, and it'll clear it right up.
What about prevention?
Prevention. Basically, rotate your shoes every day, particularly in the summer. Everyone sweats. Doesn't mean anything about your hygiene. It just means that you are a normal person. You need to rotate those shoes every day. So if you wear one shoe one day, wear a different shoe the other day. Let those shoes dry out. Keep your feet dry with some powder. There's some antifungal sprays out there that some people spray in their shoes. That sometimes helps too, but basically it's a drying solution. So you're trying to keep the area as dry as you can, and powder works really well too.
Okay, thanks for your call. We have a new call. Go ahead, sir. Ma'am.
Yeah, my name is Diane, and I had a heel spur surgery, and it keeps on coming back. I don't understand why does it keep on coming back, the heel spur?
Well, heel spur surgery usually involves a couple of things. We're basically trying to remove that spur that's there and loosen to the spur in order to give you some relief from that heel pain. Now, if even with the surgery, you still have to maintain stretching the area, keeping it loose, and proper foot care. You can get a spur back again, so it's worth getting a follow-up with your podiatrist, but supportive shoes help, and keep stretching and icing that area. Sometimes it's just getting re-inflamed in the area.
Okay, can I ask you one more thing?
Sure.
What's the difference between a screw in your foot and what do you call it, a pin?
A pin tends to be, if you can imagine, just like a pin that you would sew with, a needle. It's smooth. There's no ridges in it. It's exactly like what you sew with it, a thicker version of that. Whereas a screw in the foot is a tiny screw that you've seen screws in furniture or things that you've built or assembled. It's very similar to that. So they're two different things. So if someone's telling you we may use a pin or a screw, they're just two mechanisms to hold something in place, and they both work fine. They're both equally well. Good.
Okay, we have another caller too. Go ahead.
How you guys doing?
Good.
Hi.
I have a callus on the bottom of my foot, and it's real painful when I walk. I was thinking, what is the best method of getting rid of it?
Well, there's temporary methods and there's permanent methods. Now, depending on where it is on the bottom of the foot, you can try, like we were talking about, the lotion with some acid. That'll help soften it up. You can use a pumice stone. You can get it professionally trimmed down by your podiatrist. Now, if you're thinking, well, this comes back all the time, I'm getting sick of it, there are some surgical options out there, depending on where it's at, that we can actually take the pressure off that area